Hey everyone, welcome to the PAD Leg Saver Hotline podcast. We have a great in-studio audience. We're hanging out. You should join us. Just email info at padhelp.org to be in here. We have lots of great friends here. We've been chatting away leading up to going live. So I don't know if we're going to be able to update you or catch you up to where we are. I mean, we've talked about, guys, we've talked about the weather. We've talked about nausea. We talked about blood pressure. What else are we talking about?
Being sick from the weather.
Hi, Wanda. Oh, yeah, lots of weather, lots of cold weather.
Ridiculously.
Yeah, no. And our friend Dawn is actually going to have to brave the cold weather and go to Capitol Hill, I hear, next week. Dawn.
Yes, I don't know what exactly we're talking about exactly yet, but I find out next Monday.
Every
Wow.
single PAD warrior is counting on you.
Don't do that now. Make
I'm
my
not.
nerves go through the bucket
No,
already. No.
it should be amazing.
I'm
It's
already
literally
nauseous.
five
Please don't.
minutes.
Yeah, that's what he said. He was like, it's 5 minutes, you'll talk. He's like, but that's a long 5 minutes because we're only there an hour. I'm like, okay. But what do I say in like 5 minutes? I don't know. I'll have to have Chat GPT and Claude help me out.
So I think it's the PAD caucus and they're reconvening. It's been a long time. There was a congressman that was leading the charge for the ARC Act, which is a piece of legislation which would require coverage for early testing for PAD for any patient at risk. And I think that that's pretty amazing. It would also make it standard protocol for doctors to check inline blood flow as per society guidelines prior to any amputation. So
So
I think that
not
they
to
want to hear.
not to cut you off, but it's funny it's funny that this is all happening now because I got a piece of mail the other day. I'm a member of the Moose Lodge. Like I go there, it's more for like older people, I swear, but it's like I go there, I play bingo, I go play
Hi,
single
Sharon. Hi, Marilyn.
bingo and stuff like that. But they just sent me a flyer saying that I could now, in the state of Virginia, get tested for PAD. Wait a minute, okay? Now, I sat there and laughed to my mother and I said, "Isn't that funny? I've been battling PAD for 5 years. This December will make 5 years that I lost my leg because of it. And now Virginia is just now having testing for it. That's 5 years behind Boston. That's pretty sad. That's
Wow,
pretty
yeah.
sad." I said, wow, imagine where were you 5 years ago when I couldn't walk and you were telling me it was other reasons? Like 5 years behind. That's what it looks like to me. Like I'm estimating it by when I got diagnosed to losing my leg, which was pretty much right after, to now to be tested. Almost 4.5. We'll give them a little credit. 4.5 years, they are that far behind in. Hold on a minute. Are you guys there?
So
Yeah.
so what type of, who is the testing for? So it's not standard. They have provided ABI testing,
I
but
don't
is it,
know. Like
but
it's like a
okay.
program like that they my daughter keeps calling, I'm sorry, but she is in the other room. But kids nowadays, they don't believe in coming into the other room. They want to keep on
My
calling. Sorry.
my dad does that to me too.
It drives
He
me
actually,
insane. But I'm not answering. I'm giving you the, as they call it, the FU button when somebody calls and you like hit the red one. That's what they say it is. I'm on a thing, sweetheart, and you keep calling.
that's
There's
amazing.
no room in the freezer for your bag of chicken.
There's one bag of chicken that's sick.
Bag
Sorry, I went food shopping and she's trying to put it all away. All right, give me a minute.
Oh, so she's doing a little something, something.
Yeah.
So
So
we can
like
talk, Dawn.
I don't know exactly like what it is, but when I saw that like triggered me because I'm like,
Yeah.
now you're finally like sending out like it's like one of those I think like one of those testing like trailers or something like that maybe. I don't know what exactly they do because I kind of threw it in the trash. Because I was
Yeah,
like kind of upset. I'm sorry. Like some things still do trigger me because I was supposed to have a leg. Like it wasn't supposed to be like this. So yeah, so I threw it out. But in my mind, it said to me that they're like 4.5. All right, even if you said they do have that testing, it wasn't really present when I was suffering.
it wasn't right in front of you, right?
No,
And
no.
people just were not thinking about it. But I'm wondering if it was a lifeline screening that they were advertising was going to be happening there at
It said
um,
something
the
about
Moose Lodge.
PAD, like specifically about PAD, like checking
Right.
your arteries. Yes.
That's
To see if you had blocked
crazy.
it. But I was like, so I said to my mother, because we were talking about my dad. My dad owns a three, now it's a four family house in East Boston in Massachusetts. And I said to her, eventually maybe I might have to move back to Boston. I was like,
Mm.
because that's where the only state that has me like stable. Like I just went again, I had my stomach test. They said nothing, nothing was wrong with that, no stomach cancer. I had my test done with Dr. Dua. My legs are still at 75% where they've been since I lost my leg. So they haven't, well, they increased a little bit, but they haven't gotten worse, which is great because that's all the news everybody wants to hear. Your legs have not gotten worse, right?
Yep.
But
You've been
I've
working
had
at it.
a clean bill of sale. Like the cardiologist, I saw him. He gave me a great bill of sale. But
Yay.
it took me to go to Massachusetts to get my health care correct. Like that is not fair because not everybody is like me who has because I'm on social security because thankfully when I was young I was a workaholic. So that's what saved me going out on disability, that I was able to draw off my own social security. Still not enough to live by myself. I always need
Right.
to have some kind of help somewhere. But it's like eventually I might have to go there because what happens if I do get like sick again? Like, are they going to be able to fix me over here where I have to
Mm.
keep going back and forth? Because it's $400 a trip for me to go to the doctors.
It's a lot.
Yeah. So, because I
Wow.
drive. Because once I'm out there, I need a car to go back and forth into Boston. So yeah, it's $400 every time I have to go to the doctors. So
Wow.
thankfully I'm healthy. But what's going to happen when I, knock on wood, whatever we believe in God, whatever it may be, let's all pray together that I don't get sick because then I might have to
Yeah.
move back there because that's where the best care is. But like I said,
Hi, Anastasia.
some people can't do that with their insurance. They're stuck in Virginia.
Yep.
Thankfully, mine allows me, the Medicare Part A and B allows me to go to another state, which is another reason why I don't get a job. I stay on Social Security because then I lose that benefit of getting good health care somewhere else. And that's sad. That's sad that it has to be that way, you know?
Yeah.
Mm-hmm. I totally agree.
Mm-hmm.
Big time. Help.
Thomas, I think Thomas travels the next longest distance to get his health care as well, except his is in state, right, Thomas? But
Yep.
man, how far was that Uber ride? Was like a 4-hour ride.
Yeah, it was 169 miles
Mm.
there and then 169 back.
Yeah,
Yep.
that trip was almost to Boston, like a trip to Boston, because if you 169, that's say we'll round it up 2 and 2. Boston's like five something, six. Yeah, you almost drove all the way to Boston.
Yeah.
Mhm. Yeah, it's
Wow.
sad to get the health care that we need. It's nuts. It's nuts.
That's just like
Even
It's
when
to
still
I'd
get
an
good
go up to
food.
evolving thing.
Chicago. That's just like when I'd go up to Chicago.
Oh, Beth,
Chicago's
you
like
too. Yeah.
hours. Yeah, I'm about 4 hours south of Chicago, and I don't have a vehicle, so I have to depend on medical transportation to get me out there. They sit up there all day, in their vehicles, and then
Right,
they
because most of the time they
go
drop
to
you
that.
off and then you gotta wait, but they're too far away, so that's crazy for them. Hmm.
Yep,
So,
yep,
Don, you'll appreciate this that Beth, you've had a stroke, you've had multiple cardiac events and leg issues and everything else. And They had never checked her for clotting disorders until
Nope.
her neurologist just
Really?
the other
Yeah.
day put it in.
Yeah. And then I got a call. Well, I got a call last week stating that all my labs came back. Well, I've got like 10 that wasn't able to be done because we was waiting for prior auths. But
I
I know
know.
anyway,
prior
it's like,
authorizations.
I
Why
know
we
it's
even need
ridiculous.
those?
The
Tell me
doctor's the one
why.
that asked for them. Why
Tell
do
me why I have to put one in those every single time, a narrative of why I need a prosthetic leg or a wheelchair. It's like, did my leg grow back? I mean, come on now, are we serious? I gotta,
doctors that asked
Oh,
for this
Dawn,
stuff? You know,
I have a
why
new
did
one for you. Remind me.
so anyways, last week the nurse at the neurologist that I had seen called me with blood results, their lab results, stating that everything came back fine, nothing to worry about, everything looked good. Okay. I had some highs and had some lows, but nothing that they were really concerned about. So this morning I'm sitting here and I get
Hi,
this
Melissa.
phone call, and it was, I don't remember. Kim, I told you who it was. It was like a nurse, some kind of a nurse, specialist nurse or something like that. Anyway, from neurology. And she said that my clotting was elevated a little bit. The clotting test, which I don't know which one she was talking
Dawn,
about.
is that the INR? I don't know.
yeah, so you get
There
your
was no
PC and
INR.
INR, but
Yeah, I
I
don't
don't
know.
know which one they look at exactly. Like for me, I have to be between 2.0 and 3.0. Normal people are 1.0 to 2.0. But if I go to 1.0 to 2.0, I can clot. So
Yeah.
they keep me more thin.
Well, this neurologist person said that it was elevated a little bit, but it wasn't part of the neurology test that they was running. So now I'm sitting here, okay. And then she had
So
mentioned
weird.
something about anticoagulants, and I'm thinking, okay, that's blood, that's
Blood thinners.
yeah. And so I don't know. I called Kim up and I was trying to explain to her
But
everything that I was doing,
to
and
be
I'm
honest,
just so frustrated.
it would make sense to look for a clot if she had stroke twice. What is the cause
See,
of a
I've had
Right?
stroke?
three
Is a
strokes.
clot.
I've had
Yeah,
three
like
strokes since I was
that's what I
46
mean.
years old.
That's why you have a stroke. It's because you released a piece of a clot, unfortunately. Yeah,
This
Yeah, it could
last
be
stroke I
other plaque as
had,
well.
there was a real
right.
tiny blood clot located way far back in the hmm, oh Lord, I knew I just had
It's okay. It's just in the bag. It
left
is in your
cerebellum,
brain.
the
Right.
left
Yeah.
cerebellum
That's
part
what
of
I
the
was gonna
brain.
say, the
Yeah,
cerebellum,
the
but
left cerebellum, but it was real tiny, and they couldn't see it on a CT scan. They had to take me in and do an MRI in order to see my brain, to see what was going on in there. This because they
Hmm.
wasn't getting nothing with the CT scan. My last stroke was September 11th of last year.
what a date.
And they never did
Yeah,
any
right.
sort of, they never sent her to hematology, never did any sort of additional
No, nothing.
clotting work, put the Band-Aid on it and sent her home.
Yeah,
Yeah,
that's
that's
And
what I
exactly
so
what
mean.
they did.
she's finally getting some workup, which she and I are going to inspire the nurse practitioner in her cardiology office next week to do so, because I couldn't have imagined that someone that has gone through as much as she has, and knowing
Nobody's
that
ever
she's a
checked
clotter.
her thought.
No,
And Dawn, she's not on an anticoagulant,
the only thing I'm
and
on is Plavix, a full dose baby aspirin, and Celestazol. Those are the three
she's
things.
never been checked for, never had a Plavix sensitivity test, and a lot of women um, have issue with clopidogrel or Plavix, and it doesn't work for them. So
I
I'm
just
literally shocked.
And and
like,
I've been retaining so much fluid because I've got heart failure and kidney disease, and I'm swelling up so bad, and it's so hard for me
Yeah.
to get around. You know, it takes everything I've got just to get out of my recliner and walk to the bathroom. And my bathroom's maybe 20 steps from
Do
where
you
I'm sitting.
know, do you know what your heart is functioning at? What kind of percentage?
62% the last time I knew.
Yeah, so you hate to say
That's
it,
an
but
EJF
you would
is
be
pretty
The
very,
good.
you
last
should
I
be
knew.
very out of breath. Do you use oxygen? No?
No, I do have a CPAP machine that I use nightly. But yeah, if I'm up walking, I get short-winded really
Mhm.
easy.
Yeah,
And
that
so
makes
yeah,
sense at 62%.
yeah.
Yeah,
So
you
yeah,
actually have to watch yourself too, because well, your heart isn't functioning too.
well,
I don't know, but would you
yeah,
cause that to throw more clots because it's not functioning like it should? So I'm asking because I don't know that. Like
right.
my
Well,
thing
see, I've
is
got
because
diastolic
it's
heart failure, and that's where the
not pumping right correctly.
Mhm.
So the blood wouldn't it pool more? Wouldn't that make it? I don't know because it's not
So
moving. I would
her
think it would be more
is that
I
thick.
have
hold on,
diastolic
is
heart
that
failure.
the ejection fraction? Are you talking 62% is the ejection fraction? The
Mhm.
ejection fraction, because 62% for ejection fraction, a normal range is 50 to 70%.
So
Yeah.
I'm
Yeah.
wondering because I know like with my cousin, his heart was at like 50%. They said functioning at 50%. So he could have walked up the stairs and had a heart attack because at 50% it gets to be. So that's what they said. I don't know what exactly the percentage was, but but I remember he was at 50% because we were all trying to keep him in the hospital and he kept trying to want to leave. And we're like, you can't, you got to go to the third floor. Like you might be dead by getting to the top of the flight of stairs. Is that what you want? I mean,
Does your ejection fraction percent, does that determine that you do have coronary artery disease?
See, this is
That's a
no,
good
it's,
question.
I mean, that's more heart failures. The heart failure measurement shows how much blood leaves the left ventricle, right, with each heartbeat. But a normal EF is between 55% and 70%. A lower EF can be a sign of heart failure. So that's where I'm confused if you're
Yeah,
at
the
62%.
last I knew it was 62, but that
Mm.
was before I was told I was in heart failure. So I don't know what it would be now, but that was last year sometime, I think last summer or something when I was doing better. But no, see, I've got diastolic heart failure, and what that is the heart stiffens up. The left side of the heart
Okay,
stiffens up. It'll pump the blood out, but it has a real hard time pumping that blood back in.
gotcha,
It's not
gotcha.
working like it's supposed to. And then I've got aortic valve disease in my heart on top of that. And I've got coronary artery disease. I have a stent in the LAD valve. So I've got all this going on with my heart. And so I've got chronic heart disease, heart failure, chronic heart
Yeah,
failure.
we're gonna sit there, we're gonna map it all out with her so that we have a clear picture of what's going on. Make sure, because you are a clotting risk, we want to find out if there's any reason, if there's any additional reason. It could be valvular issues and such, but if you have valvular issues, which you're telling me you have leaky valves, that I would imagine that your doctor would still have you on Eliquis, but I remember that discussion when they took you off. So that's a discussion that we're going to have next week with your nurse practitioner for cardiology.
And
Does that
my
sound good,
question,
Beth?
yeah, that's fine. But my question is, with all this going on, now my right leg from my knee up to my thigh, up to my groin area, okay, my hip, the outside from my knee all the way up goes numb. The front from my knee all the way up is going numb. So it's like I get this numb feeling in my right leg, and it lasts, probably a good couple hours, and then it'll go away.
Yeah,
And even
you're
if I'm
sitting
walking,
floor as well.
even
We're doing a lot
yeah,
more sitting too.
even if I get up and walk, I still have it, and
Still
it
have it.
affects
I
walking.
wonder if it's pressure on your sciatica. It could be.
My sciatica's not bothering me though.
Hmm?
My sciatica is not bothering me. So, but anyway, next person.
Right.
We're going to take care of you next week. But Dawn, look up 50 legs, 50legs.com. We
Okay.
just had actually a friend you're going to meet in person next Wednesday. Legendary Harlem Globetrotter Larry Shorty Coleman is going to be with you at the state capitol. We're sending him your way. And he just got back from Orlando and he got a new prosthetic from them. And he
Nice.
went down there for 10 days, got a new prosthetic. They taught him to walk and they took care of everything. So you can go to 50legs.com, you can apply for it, let them know your situation, and let's see if we can get you in that program.
Yeah, because so I talked to my lovely doctor, Dr. Dua, when I was there, and she's like, "What are you doing in the chair?" And I'm like, "I don't walk." Because she's like, "Where's your leg?" I said, "You took it." She goes, "I know that." I said, "Well, what leg are you looking for?"
I'm
She said, "The
glad
prosthetic
you
one." I'm
gave her
like,
heck.
How
"Yeah, oh,
funny.
we do." And my son's friend was with me, and he's like, looking like, "You and the doctor talk like this?" Oh, we were talking like, because we were talking plastic surgery. Because I told her, I said, the fat on my leg is just like literally I can move my stump and it jiggles like a bowl of jello. It's gross. Like it's just flaccid, no muscle and loose fat because I've lost in 100 and
Yeah, you
I
look
think at
great.
one point I was like 315, but that was 10
Oh,
years ago. But over the years, like I keep losing more weight. Now I'm stuck here at like 173. I can't go anywhere else. I'm like plateaued here. But if you look at my body, I look like a bowl of jello. Like it's gross. When I go swimming, you could see it like. Sorry if I'm grossing any skinny people out, because some skinny people don't like to talk about fat, but it's the truth. And she said that
It's fine.
we were talking
It's
about
the
plastic
reality, right?
surgery. It is because I need to be able to get my leg more firm, I believe, to be
Yeah,
able to fit the prosthetic better. So we were talking about plastic surgery and we were talking about my blood clotting disorder. Because like I went in for
yeah.
a colonoscopy and I cried when they were going to bring me to the operating room. When I went for the endoscopy, I cried like I was now. I don't want to be put to sleep. Like I'm terrified of it. Before this, you could have said, Dawn, we're giving you a free body makeover for nothing. All you got to do is hop in this suite, the surgery
Mm,
suite, and I would have been in there. But since I lost my leg, it hurts me like, and I cry about it. So for me to go through like plastic surgery, that'd be a great idea. But like even she's like, she goes, as a friend, I wouldn't suggest it, but it's not my specialty, like she said. She said, so go to the
mm.
appointment. She said, and see what they say and what the risk is, because then it's up to me to see. Like, I'm not going to be able to move around as much as I do. So, what is my risk of developing a clot? Is it going to be
mm-hmm.
worth developing the clot, or is it worth me walking? I'd rather walk, and I'm going to be honest because my bladder is getting weaker being in the wheelchair. I've
Mm,
had 3 kids. So in age, like those are all playing at me and I'm not 50. So honestly, I don't want to wear a diaper. So
no.
like when I have to pee, I might have to be like a guy on the side of the highway and like literally I have a method to pee outside my car because I'm not peeing my pants. Like so there's like pros and cons now to me walking. Like before I'd be like, hey, I can do everything in this wheelchair. Well, now come almost 5 years later, my muscles are aching. Like at nighttime, I have to like lay certain ways and keep moving because I'm stiff as a board.
Yeah,
Or my one foot that I have is now cramping and my toes are going like this and like this at night because my foot got too cold at night. Like sleep isn't even fun anymore because I'm in the chair. So like I
yeah,
want to walk. Like plastic surgery sounds so enticing, but then again, like the pros and the cons of it, like is it worth me going under the knife and possibly losing the rest of my leg or getting
yeah.
a blood clot and dying like it went somewhere else, it traveled. I don't
Mm-hmm.
know, because when
I just wonder.
they put me on the Lovenox shots for the endoscopy, and my blood was in the one range on the Lovenox shot. So that's not good. Like my body
Yeah.
does not do well with anything else. Yeah.
So I
So like I
wonder,
have,
check out the 50 legs and see if they have some answers, and maybe they
yeah,
could,
something.
I mean, they
'Cause
might be able to get you a more flexible. Supposedly, they had different people with different sized ones. They really customized. And there's someone that lost his leg at the hip, and Shorty said to us, "I've never seen a prosthetic that big in my entire life." And so, there might be some ways in which they can help. And I would definitely check it out. And it's all
I
expenses
will.
paid. And, I think that you're a perfect candidate for it, and I would love to see you. You deserve
Somewhere
it. You've been working
they
so
gotta
hard.
have a way to make it. Yeah. They have to have a
And
way to make it. Like, because I've just given up. I'm looking at her right now. She's laying across the floor, just laying there with her shoe. And I say
oh,
her because she's a her, because I'm a her. So that's a her leg. So yeah, she's laying like she stays charged. I don't even touch her. I haven't put her on in like 3 months, maybe
and I
4 months.
I think that when you're up there, I think they wanna hear the lived experience, and that, vascular doctors think that it's no big deal to lose your leg, and they won't even check. A lot of these doctors do not check inline flow. Patients need the best chance of keeping their leg, or they're going to end up losing a leg in their youth, especially with high diabetes rates, high chronic kidney disease rates. It seems to be an epidemic. And I wouldn't wish this upon anyone. I
No,
mean, tell them what you have to do. Do you realize, like, I'm a 40 something year old woman and I literally pee myself. I can't make it to the bathroom. I have to keep a pad on the floor because if I get sick, I can't make it to the bathroom. Like,
I throw
this is
up
the
in the trash
reality.
barrel next to my God. If I get the flu, I'll tell you, I got the flu one time where it was both ends. I stayed in the bathroom because where else am I going? I'm not making it back. Getting from wherever I'm sitting into a wheelchair, getting the wheelchair to the bathroom, then my bathroom in my bedroom, I have to put a walker on the other side of the door. So now I got to stand up and then
Yeah.
catch the walker. Then I got to hop 5 hops to the toilet. By
And
that
maybe
time,
ask them,
whatever
maybe
you
ask
got's
them the
going on's
question.
out.
What if you
Hmm.
asked them the question and you said, when was the last time you all sat up there and you really had to pee? And it got to a point where you couldn't leave your chair and you almost peed yourself. I can't wait that long. Literally, if I have to pee, I have to pre-plan. There's no waiting for urgency. I have to pre-plan to pee or I will pee myself. Like,
I want
this is
like
things they have to understand.
more so the ladies go into the bathroom when you're out in the public. Go to the bathroom. Take a peek at the handicap stall. That's probably
Yeah.
the dirtiest stall in the whole entire bathroom. Do you know I don't use it most of the time? I have to hold on to the top of the stall and hop, hope the toilet paper holder is sturdy enough to get me to the toilet. Some will say I'm nasty because I can't flush the toilet. If I'm standing and holding on for dear life, do you think I'm turning around and trying to reach over a toilet on one leg and flush it? You're crazy. Like it is so hard to do anything with one leg. But I've managed because you have to adapt. You have
Yeah.
to adapt. Like I
That's
tell everybody, and I told a gentleman today, he said to me, "Do you want help? I'm coming out of Walmart. My carriage is overflowed. I'm pushing it by myself with my wheelchair. Mind you,
You're so amazing, Dawn.
it's not an electric wheelchair either. That's a whole nother story. They gave me one. We'll sum it up. They gave me an electric wheelchair, guys, that if it hits something, a bump, I tip over. Guess which way I tip over? To the amputated side. So is that even worth riding? No, not at all.
Oh
Okay.
my
So
gosh.
and then they didn't tell me that you got to keep the battery charged at all times when you don't use it. So guess who has no batteries for any of her riding utensils? Me, because they never told me that either. Yeah. I left a message to
wow.
try to get a new one that has 4 wheels, like a trike. But as you can see, I don't have it because they never called me back. And I didn't follow up. And I'm, because it's always like goose chase for everything you need. My wheelchair is broken. The one I've got 4 wheelchairs. I've got one on the other side of my house because I have 1 step, and I have hardwood floors over there. And if anybody knows, if you walk on hardwood floors all the time with rough wheels or something, it's going to eat the floors. So I leave that as my indoor. Then I have a wheelchair that I use on my side of the house because I have a suite on my side of the house. Then I have this wheelchair goes in and out. Then I have a wheelchair inside my car that goes to the store with me because I can't get to my trunk from my house to get to that wheelchair. So I have to use separate wheelchairs. So that's about $150, $60 a pop. They don't even last me 6 months because I use
Oh
them
my
so.
God.
Yeah, so the one my mother just bought me, Carlos tightened it and tightened it and tightened it, and every time you open the seat, the things pop off, so you can't open it. Yeah, it's a
So we just
pain.
have to get you on your, we have to get that prosthetic. So first
We
thing
gotta
tomorrow,
get
get on,
everybody
please.
writes a letter to 50 legs. Dawn needs some help. Remember that.
Yes.
50 legs, call
Yes.
them up, write them up, do something. When you're
Yep.
bored sitting down, got nothing to do, Dawn needs a leg because
Yep.
now it's becoming the body is getting sore. Before I was like, hey, I'm young, the chair's great.
Yep.
Now it's becoming a nuisance. Yeah, and
Well,
I'm
we're
hurting.
we're pulling for you, and we can't wait to hear next Wednesday. Maybe you can join us next Wednesday as well and tell us how it went with the PAD caucus, because it'll be interesting. There are going to be some it's going to be a pretty quick 1 hour, and literally the 5 minutes there, it's hardcore 5 minutes. And what you can do if you wanted is you could even say, hey, can you ask me in and give a few questions that someone, as part of maybe one of the doctors that's there, like Bob Tahara, I could introduce you to Bob Tahara. Bob Tahara, vascular surgeon, could ask you a few questions, a key questions. So you make sure that you say what you need to say in a succinct fashion and tell them what they need to hear before you leave, because they're there for specific reasons, right? So that's what I'm having them do with Larry Shorty Coleman. I'm just like, you know what, you can't expect, someone to know what you need them to know. We could go in a variety of different ways, but what do they need to hear
Right.
from these 2 particular people? And I think number 1 is the early testing. Number 2 is both of you are young, you're even younger, that this is not an old person's disease. This is not a lazy person's disease.
Oh,
Both
wait a
of
minute.
you,
Old person's disease. I have a
yeah.
disease that leads to PAD that my 10-year-old has. So it definitely is not an old person's disease because
Nope.
that's what her high lipoprotein little a can end up giving her the PAD. So
Mm.
Yep.
nothing discriminates nowadays. We have colon cancer in 20 and 30-year-olds.
Yeah.
Why? Like they need to stop with age because nothing discriminates. Nothing does. Disease does
Not
not.
anymore.
People do not. Nothing discriminates. I mean, people do, but you know what I mean. Like
Yep.
it doesn't matter anymore. It doesn't matter. Everything is changing, and things need to change with the time. Like everything needs to change within time. And
Yeah.
a lot of
And
this stuff needs to change. It needs to change. It's not fair. I don't
but
care about
imagine, I
that.
think one of the points, you having a high risk factor of having coronary artery disease, you should have been tested for PAD. 3 in 5 people who suffer a
I
heart
had a
attack
heart
have PAD.
attack. I had a heart
Right.
attack, never checked my legs. I had a heart attack, and I'm telling you, my legs are hurting all the time. I can't walk. My feet are cold. But you never said, even being diabetic, he never took my socks off.
See, that's exactly what you need to say. I had a
Didn't
heart
check
attack.
my pedal pulses. Never checked them. Like,
Never.
why? Because they don't have time. I'm sorry. That's exact. You got to go in with a list, 100 list. All right, you're in the room, doctor. Great, I'm doing great. Let me go down my list. I need my legs checked, neck checked, my ass checked, my hanging toenail checked, everything. But you know what? In Virginia, they can't handle a checklist. Massachusetts can. You go
Isn't
in
that
with 2
interesting?
problems in the emergency room, and they can't handle both things either. You got to come for one or the other. You go to Massachusetts, something falling apart, and they can put you back together. Why is that? Why are we not all on the same pattern? We're all the same people. We all have same diseases. Our bodies all work pretty much the same until things happen, and then some bodies work a little different. But the making of us is all the same. So why is all this healthcare different everywhere?
I don't know. I don't know. Wished I knew. I wish I understood more. It aggravates me too.
Yeah, I'm Wanda. Yep.
Because
The
we
inconsistent care.
yes, it's everywhere. It's everywhere. Why doesn't one doctor that specializes in this know what some other doctor specializes in? Like
Yeah.
even when I go for my car, like my car was acting up when I was in Massachusetts. So I had put it in the shop. They said that Virginia did not fix my torque converter correctly. There's certain
Mhm.
steps that you have to do to fix it, because if not, you get crap in your transmission, right? So we're 2 days shy of a year from the fixing it, and starts going bad. So of course I take it in. Massachusetts don't want to touch it because Virginia didn't do it right. Virginia's saying it's the warranty company's fault because they said they didn't want to pay for a piece. Well, you know what? Your mechanic knew the steps of how to fix the torque converter correctly. Why did he avoid important steps that would cause further damage to my car? Because it's about this. It's not about the customer.
Yeah, you're
And
exactly right.
and the guy, you know what he kept saying to me? Ma'am, I understand. I understand. I said, excuse me. And this is when I got nasty. Do not tell me you understand again until you have no leg and you're in a wheelchair and your car is your legs to get to the corner store. So please do
Yeah.
not tell me you understand. I am so tired of hearing I understand. You don't understand. Until you're walking in someone else's shoes in their situation, nobody understands. I understand statement is to hush the person so they supposedly feel a little better. Me, that triggers me. Don't tell me you understand.
Yeah,
Unless
exactly.
you're in the same shoes as someone else, no matter what the situation is.
I see Beth nodding.
Yep.
That seems to be a trigger for you too.
Yep.
Because you don't understand. Like everybody's in a different situation. Yeah, we're all in this group of PAD together, but even if you look at everybody's PAD is at a different
Pretty
level.
different. Yep.
Right.
Somebody can walk 10 miles. Somebody can walk 10 minutes. I
Yeah.
can't even walk 10 steps. I could crawl 10 steps, but everybody is in a different place. So unless certain things you can understand, there's certain things we can relate to because we are going through the same thing. But if you're running around and you're running around with two legs and you're trying to compare your life to mine, they're not the same. They're not the
No.
same. They're not the same. I wear a trash bag to go down the stairs in the snow and in the rain so I don't wet my clothes. Because how else was I getting down the stairs? I had to figure it out, right? I'm not having saggy pants, then getting in my car all wet. Now my car seat's
Yeah.
wet, the wheelchair's seats are wet. The only thing
Mhm.
I haven't figured out yet is if it's raining, how I go out and hold the umbrella. Because
Yeah.
we don't have umbrella hats that go bigger than the wheelchair. You know what I mean? They do have those little funky things. I don't know if I'd wear it on my head though. You know, like there's some things I'll wear, some things I won't. I don't think it's the umbrella hat, but
Hey,
but
they have, not to
honestly, like
interrupt you, but they do. Have you ever been on Temu? Do you ever go through
yeah,
Temu?
yeah.
They have umbrellas for wheelchairs.
But is it a good one, or is the wind gonna blow and it's gonna be
Yeah,
stabbing me in
no.
the eyeball? I mean,
Yeah,
That's true too.
you know what I
Yeah,
mean?
that's
Like,
Maybe that's
true.
how
something
sturdy is it? That's my
That
you're
thing.
gonna
makes sense.
invent one, but Don,
Yeah.
I
you'll
have
invent
so many
one.
inventions. I just don't have the money to initiate it. If I could find somebody to invest, I have many. My daughter had a G tube. They don't sell any type of attachments to hold the G tube up higher than a child. So when it's lower than the child, it doesn't go very well. The machine will beep. So like there's so many things. Like my brother was little. He was talking about parachutes in the airplane. Then all of a sudden they started having parachutes in the airplane. Like,
Yes.
yeah, you just got to find the money to invest. I just
Yep,
Mhm.
don't.
that's true.
But
And
there's many.
Thomas, I saw you trying to jump in there. Hi, Sharon. Hi, Marina. Hi, Anastasia. You can always jump in. We are a free-flowing
No, I
conversation.
was just listening.
Yeah,
Hi, Anastasia. How are you?
good. I've got a job offer, so it looks like I'll be going back to work soon.
Oh,
Oh my gosh.
Rock on.
congratulations.
Yeah.
That's
My, my short-term
amazing.
disability hasn't run out yet, but yeah, but kind of nervous, but excited.
That's
Where'd you get it at?
understandable.
Can you share or no?
At a federal prison.
Oh, nice. Are you a guard, a nurse?
I'm a nurse. I'm a nurse.
Oh, okay.
And I was just
My
gonna
mom
say,
works.
Dawn. Yeah. Go
She's
ahead,
a
Dawn. Tell
nurse
her.
in the prison too. Yep, in Virginia.
Yeah. Well, I've
Mm.
just got through. My career was in dialysis. I was in dialysis for over 30 years.
Well, you should be able to take them. Just remember, they could be quite nasty. That's what she says. Nasty. Especially if you're in a guy's ward and you're a female. But she looks
But
at him like, I'm
it's
60
amazing.
something years old, sweetheart. She's got like 18-year-olds talking dirty to her. And she looks at him like, I could be your grandmother. Like, what the hell is wrong with you?
But
Wow.
it's an all male prison and it's an
Is it?
ice prison.
Okay.
So nobody talks English.
No. Oh, some of them might. I don't know if they will there, just so you don't know what they're saying. So I know I
Yeah.
wouldn't. If the majority of the people spoke English and I could speak another language, I would speak that language, just so
Yeah.
people would know.
Yeah. The only bad thing is a 3 to 11 shift, but it'd be all right.
Do you just give
Wow.
meds? Or do you have to do treatments? Like, what did they do there? Some
I'm
prisons
just
don't let.
basically my job, according to everybody, will be boring because at 3 to 11, I'll be the sick call nurse, which basically they said you don't do anything but sit there and maybe give a Tylenol every now and then.
Well,
But
That's not bad. And sit there and get paid for it.
right. I
yeah,
mean, yeah, like my mother too. Like, it does get boring when they have like downtime and she's done with her, like, writing her notes or whatever. They really can't like surf the internet anymore or nothing. They have to just like sit there and look at each other. But they get paid good money. I don't know about where
Oh,
you
we're
live.
gonna
But she does.
it helped me ease back into it because I was in that wheelchair for so long before that my surgery in November where it fixed my legs.
yeah.
So I'm still trying to get my stamina built back up.
Right. So that might be good that you're not trying to kill yourself, right? Going back in, easing it in.
Yeah, my kids are
Yeah, how
trying to
long
convince
were
me.
you in the this is it's so sad. You guys got to hear this. You were in your wheelchair for how long? I mean, before they actually did something,
A
which
year and a
drives
half,
me crazy.
a year
See?
and a half.
Before they fixed her legs. Like how many dismissed you?
Well, the doctor I've been seeing in Jackson just dismissed me and told me my only answer was amputation
Oh, and
until
you now have
until
your
I
legs.
researched.
Imagine if you did that. Oh my God.
Until I researched and I found a doctor a ways away from my home and found out he was one of the country's best and he
So
fixed me.
she posts in the group, yeah, my doctor's one of the best in the country and blah blah blah. And of course, it raised my spidey sense and red flag. Like, you can't really say that in the group because we have so many people that will post that their doctor's the best of the best. Then I find out that they have highest rates of amputation, and meantime behind the scenes people are messaging that person for that doctor's name, and then I get word back that their legs were amputated, and it's kind of like, oh my god. So she was nice enough to actually, Anastasia was kind enough to kind of understand where I was coming from, and instead of being combative and defensive, she came and she wrote me the nicest letter, and she's like, yeah, well, here's what it is and who it is. I was like, well, I stand corrected. Yes, he is.
And
Yes,
he is
he
really
is.
he's keeping a close eye on me. I'm seeing him every 2 months.
Yeah, I'd love to. We should get you on with him. He's willing and you're willing. We should tell your story because so many could learn from your situation. And I'm so upset, with everyone, even who's here. There's just so many things that I wish that doctors would understand and give up the patient instead of giving up on the patient. And it's very frustrating, very frustrating. And I know that, Don, I wish yours would have given you up earlier to someone who could have treated you earlier.
Well, he
I
didn't
mean,
want to give me up, actually. He didn't. He was
right.
trying to do the procedure again. And I was like, no, because why did I reclog so fast? That was the words I used to him. And to be very honest, come to find out, he's one of the best vascular surgeons around my area. But the problem with this gentleman is language. All he kept saying to me was walk, 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 walk. All you have to do is walk. Okay, I'm telling you, I can't walk, 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 walk. I can't even get from my car to the Walmart door where I am hysterically in tears having to sit on the floor because both legs have now cramped up to my hips. Like I can't walk. I'm using
Yeah.
a wheelchair sometimes. Like his answer, walk, walk, walk. Couldn't understand what he said. And then I let you do the procedure where honestly in the procedure I woke up. I saw what the
Mm-mm.
plaque looked like that came out of my arteries. It looked like chewing gum, almost like a, it was very sticky like chewing gum, but chewing gum will pull more. Almost like a sticky piece of cheese that's kind of melted but didn't fully melt. So when you pull it, it pulls a little bit, but then it like pulls apart. That was how it looked. Because he said to the nurse in the room,
God.
do you want to see what we got out of her artery? And I said to him, yeah, I do. And he said, oh, the patient's awake. Yeah, the
Huh.
patient's awake. How you doing, sir? So like I'm awake during the
Uh,
surgery. Now you go to do my other leg, I can't stay still. Like you want me to stay still. Like I can't. My nerves are crazy. I woke up during the last time you touched me. My legs are now reclogged. Like what's going on here? Like I was afraid. Like you keep touching me, but nothing's getting better here. So yeah, he was all set to do it again. And then that's when I found Kim. But because of the lack of care over here, when I went to Boston, they didn't
Yeah.
know I had a blood clotting disorder. Nobody even checked me for that over here. I went up there. She asked me to walk too, and I told her honestly, Dr. Dua, I cannot walk. I cannot walk. You want me to walk and it cramps. And then when I try to walk, it feels like my legs are going to just snap or just break. Like if my legs even got cold, they felt like they were going to shatter. Like if you was to smash like a glass and it just shattered. That's how my legs felt all the time. Everybody wanted, but I was to the point I couldn't walk. She asked me, please, can you go home and try to walk? And I told her I can't. Even my mother was there. She was like, it's to the point she cannot walk. You know, like I have to live life. I have kids. Like I can't just not walk and eat. Like I couldn't walk. I had to live life. So we went in for the surgery, and unfortunately, God had other plans, I guess, to tell all of you guys to save your legs and walk, 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 and walk, 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 because that's what I'm here for now. I try to advocate for people. I try to now help organizations that help people with disabilities because now I'm in that population. I'm now a disabled person. I
But they
wasn't
didn't tell you
before.
how to walk, right? If they would have told you how to walk
No,
earlier.
no, and that's again, that's expected here because the healthcare is so far behind. He said walk, but he didn't tell me. Nobody would just walk. Well, I can't walk. I can't walk. Well, you can't walk. Try this medicine. And that's when he put me on that medicine that she said she was on, the clozistazole. I can't
Cilostazol,
take that.
maltitol.
I
yeah.
cannot take that. I cannot take that. It made me have the
Heart
butterflies in the
palpitations.
chest.
Yeah.
Yeah, which would have gave me heart damage if it kept on going. So yeah, like nope, can't take it. So you can't give me medicine for intimate clotting. You want me to walk. It's not possible. So my only solution was surgery, but I didn't want to allow Virginia to touch me again. Unfortunately, I was the first patient that Dr. Dua ever had the opposite reaction in the operating room where I came out, she came to test my leg, and I was like, oh, I don't feel it. Can you move it? Nope, we can't. So it was like I immediately clotted right after surgery. And when they tried to bust the clots with the busted medicine, it caused me to
It
have a beginning of a stroke. So it was causing me to bleed in the brain. So they had to stop that because just like I'm talking to you, I was talking to my mother, and then 2 minutes later, nobody could understand a word I was saying. They were like, "Oh," and she's a nurse, so she hit the button, and that's what saved me. There was the immediate response they gave me in the hospital, and they took all the blood clotting medicine away, the blood busting, the clot busting medicine. They had to pull it away, and then they had to see what my leg was going to do. And as my leg sat there, it just built up the gases and it started eating more of my leg. Within the next day, they came and said, "We're going to do a fasciotomy." They literally picked my leg up in the bed in
Right
the
there,
regular
yeah.
room, and they sliced it open all the way up to my knee, from my foot to my knee. And guess who didn't feel not a thing? Me. So at that point, I said, "Oh, I think I'm fucked." Just like that, I said to myself. And he said, "Huh?" I said, "How come I didn't feel that?" "Oh, well, that was because you were on all the medicine still, because I was still, like, I think 1 day post-op. So I'm still on heavy medicine. Didn't feel it." Come to find out, they do a below the knee after that, because now the tissue, the gases started to eat the tissue of the leg. So it was becoming very necrotic fast. And the gases were traveling, going to take more tissue away. So they did a below the knee. Then they came and they retested again where the blood flow was. It was exactly to the kneecap. So to be able to get a prosthetic leg, I had to go above the knee. So I pretty much got like 4 surgeries in 7 days. I don't think I ever came out of anesthesia, pain medicine, nothing. Didn't know if I was coming and going at a point. All I just knew is I was consenting to have my leg taken off. I asked them if I could wait till the next morning. I turned to him and I said, because he came to me, it was late. It was like very late, like 8, 9 o'clock. And he said to me, um, "We're going to have to amputate your leg some more. Because if we don't and we let it keep going, you could end up to your hip." So I said, "Okay, let's go." I said, "But can we wait till the morning? I'm awfully tired." I said, "What would you do if it was you?" And he looked at me and he put a face, and it was a worried face. And he said, "If it was me, I wouldn't wait till the morning." And I said to him, "Well, I used to work in the my degree is in the operating room." I said, "So you need to go have a nice something to eat so you don't pass out on me." I said, "And then go get scrubbed up, and I guess I'll see you in a little while." That was it. The next day I woke up, I had no leg up to above my knee. And what was the one thing the doctor said to me? Wasn't Dr. Dua. Was another one. "Don't you worry, you're young. You will be walking within the first year."
See, they say that all the time. That's what they tell everybody, is that they really, really, honest to God, think that that happens, but more than 60% of patients with PAD who are getting amputated are not walking in the first year. It's literally everyone's ending up on disability because you can't get prosthetics, they don't fit. It's not as easy as you think to heal the wounds, and
You can't
I
shrink a
know.
leg. Try putting a shrinker on this leg. I haven't had one doctor yet from
Yeah.
Spalding Rehab, which is where they did the marathon bombing people. My brother's friends. They put shrinkers on people all the time. We got people coming from different countries to that rehab. Not one person could get a shrinker to stay on my leg because of the way my leg morphs when it moves in different ways because of the loose fat. So I never was able to shrink my leg like you're supposed to ever get it to go down to a small size where it should just stop, where a prosthetic leg will fit it. I've never
Yeah.
ever been able to. They could never, as soon as I'd stand up, it would fall off, or it
Oh,
would unravel, or it wouldn't, or it was pinching, or that, like, unless you're skinny, those things don't fit you very well. Skinny and in shape, because if you weren't walking before that, you're not going to walk with a prosthetic leg right away
yeah.
because you're not strong enough to move it. Come to find out, I do all this lovely stuff in my wheelchair. And when I go to therapy, my strong leg is not the leg I still have. Believe it or not, my strong leg is my amputated leg because all the muscles that I use to claw myself with my foot to push myself
Yeah.
is not the same muscles you use to walk. So here I am thinking like, Oh, I'm keeping the leg healthy because it's not getting more disease, but it's not building up any muscle to help me walk because it's not the muscles that I guess are in the back of the leg and in the the back of the thigh and stuff like that. Yeah, so you lose everything being in a wheelchair. It
Yeah, and
stinks.
I think the moral of the story is there is a lot to be done, and I think that we picked the right person to speak on Capitol Hill next week. I think
I
everyone
just
would
got to get to
agree,
the right
right?
points in 5 minutes.
Well, you know what? Actually, we have recorded this whole thing, and I will get you the transcript, and we can work from the transcript.
I mean, I even
And
thought the one that I did for you before was
Yeah.
good too. Remember, I got out all the points because I actually did an outline for that, the one you taped that time, because I
yep,
wanted to get the points out because it it messes with you every aspect of life. Even like I said before, the religious wise, like getting an amputation. Who do you think I questioned? Who was the first person I questioned when I lost my leg? God, why? Right? So now I'm rethinking my religion. Like, why would he do this to me? Like how big hearted I am. I do everything for everybody. I'm responsible to help my mother. Like I help my mother, my aunt. Like, and then you take my leg. Like now I can't help the people I help. Like the first person I questioned was him. So
yeah,
it takes everything from you, every single thing. It messes with you here. For a very long time, I kept forgetting I had no leg because I had to retrain my brain. 40 something years, I had a leg. Where did it go all of a sudden? Like, what do you mean there's no leg?
yep. We hear
Or
that all the time
sometimes
that
it
people,
feels like it's there.
yep, and you fall out of
And I
bed,
get the
right?
phantom. Well, I lock my wheelchair. And to this day, if you look right here, real quick, there's my wheelchair. And here I
It's right
am,
next to you.
right next to me, because I'm not taking that chance. It took me, I fell down twice on this leg, on the amputated leg, and pile
Yeah.
drived it straight down. Never again. I will have 20 babies, natural, with no medicine, before I ever pile drive my leg into the floor again.
Yeah. Yeah, I
Like we
remember
were
you were in
talking,
the
my
ER for
friend.
that one.
Yeah, I
Yeah.
said they gave me fentanyl. Fentanyl was the most fentanyl they could give me on scene. They couldn't give me any more drugs, and I was still screaming. That I swore I thought my hip was broke or my
Um,
bone went like up into my body or something. That's what it felt like. It jammed. But no, I had nothing but all the muscles were pulled and strained.
Oh,
Yep.
man.
And that's probably because I sit. So they're used to being in the crunch position. Then I had it straight and then I forced it. It went down and then it went out like sideways.
I mean, I
Yeah,
think
Rick
that
was
this,
bad.
if any vascular surgeon, was looking at this, or a general surgeon or an orthopedic surgeon would listen to this and understand what life is like and what they're really sentencing people to. And I almost feel like every single vascular surgeon, general surgeon, orthopedic surgeon, podiatric surgeon should have to shadow someone with PAD who is an amputee for not just a day, but for a week and really see what life is like. And so
They
it
need a
makes it,
shadow, somebody who's very active like me and someone
yeah.
who can't really move because it goes both ways. Some people are older and have more ailments and I have arthritis and everything else or something with their back or and they can't move. So they're
Yep.
going to be worse than I am because I'm tired. Like right now I'm tired. I went food shopping. That person's going to be exhausted to the point they might not even want to be around anymore. You know what I mean? Follow both people and see how it is.
Yeah,
Because you're
I
gonna
See, and
agree.
see,
that's
you're
kind
gonna
of,
see
I'm kind of in that situation where me having a hard time getting around and stuff because I've put on all this weight. Normally, I'm a small person. I've got retained so much fluid. I'm up to 232 pounds, you know, and that's the most I've
and
ever
your
weighed.
body's not used
And
to that, so
it's
it
not
hurts
used to
more.
exactly.
Hmm.
So I've got all this fluid. I'm fluctuating between now 226 and 232. Okay. with all this fluid, and I want to be able to get out and walk. I used to be very, very active with my walking. Kim can tell you
Yeah,
that.
you were.
And I can't do it now. It hurts to
Well,
move. And the
well,
doctors are
I
like,
think
Beth,
too,
when
right?
you're
Is her
too apart,
muscles, are
well, the
her
doctors
muscles
are
not
like,
getting all the oxygen either, right? Because you're not breathing correctly.
yeah. My doctors are like, Beth, right now, we're not going to worry about you getting out and getting the exercise like you used to. Right now, we've got to worry about figuring out how to get that fluid off of you.
Right, because that's what's
So,
more important, to be
okay,
honest.
I've been waiting and waiting and waiting for what's it been now? 3, 4 months that I've been
Yeah.
dealing with this. I'm on 240 milligrams of Lasix a day, and I'm lucky to pee maybe 3 or 4 times a day. Yeah.
They checked your kidneys again? Because that sounds like kidneys now.
Yeah, they're always on my checking my kidneys. I'm stage
Mm.
3 kidney disease.
Well, I wouldn't imagine that you'd be there. That's why I want to have a conversation with your nurse practitioner and let's
You know,
let's literally
I'm
get to the
over it.
bottom of this.
You know, yeah. I mean,
If I have to send you, if I have to literally send you by Uber and just pay for you to get all the way up to Chicago, then that's just what we're going to have to do because I really think that you need a full investigation. I think that you're just getting, half investigated at the community hospitals. So we're going to get that. We're going to get you to that. I know it's so hard, Beth. We got to get to the bottom of this for you so you don't have to suffer.
I'm
Um,
tired of crying. I'm tired of feeling like this. I used to
I
be
know.
active. Now I can't be active. And it's I don't know. I'm just, you know, and Dawn is like you say, doctors are like, we understand. The fuck you do. You don't
You don't,
understand. You know,
exactly. You
it's
don't understand.
my boyfriend. He's like, or whatever I want to call him, or whatever, roommate, whatever. Um, he's always complaining that he's in pain, and I'm like, you know what? I'll take your fucking pain any day of the week. You take mine. I live in pain 24/7. My legs, my back, from my mid back down to my hips, my lower back. I can't stand for 2 minutes out cooking without being in excruciating pain. I'm so tired of the pain, and nobody wants to do anything to help me with it. So I suffer. I deal with it.
Yeah, you
And
have
I
some
get
serious
that.
core issues that I think are not being discovered. And the fact that you still
Hmm.
have yet to have a full workup, a blood workup, or a neurologist finally doing the blood workout up that you need. But
Yeah,
we're
it's
gonna
crazy it
have
took
that
a
conversation.
neurologist. Yeah, it's crazy
Right?
how it took a neurologist.
Yeah.
But I thank you guys for being here and being so honest and so candid. Hopefully, people will watch and we could get some surgeons to watch and understand what people are going through and maybe a little extra compassion will help, people to the doctors to take a second look, to give people a second chance at keeping their leg and ultimately their life. But thanks everyone for joining us. For those of you in the live studio audience, we can stick around. I'm going to end the broadcast because I want to attend as I'm sure people who are watching on YouTube would understand that we have some serious discussions that we're having, and I don't want to ignore those. I want to expand on them. So we'll the broadcast clear. Make sure to like the video, subscribe to our channel, and join us in our live studio audience. info@padhelp.org to share your lived experience with PAD.